All right, let's dive into this Dutch pharmacy situation. You guys sent over a ton of articles on this, and wow, this is a lot more than just a strike, you know? It feels like the whole Dutch healthcare system is kind of under the microscope here.
Yeah, it's pretty wild how this one event, the pharmacists striking, is like it's bringing all these deeper issues that have been bubbling under the surface for a while now.
Right, like we're talking about pharmacists, the people who, we trust with our meds, feeling so overworked and so undervalued that they're actually walking out. And during the holidays, no less. I mean, there's got to be more to this story, right? So where do we even begin to unpack all of this?
Well, on the surface, you've got pharmacists complaining about, low salaries, long hours, a workload that just never seems to end. But I think if you look a little bit closer, it's not really just about the money, right? Their frustrations, I think, point to some bigger systemic problems within the whole Dutch healthcare system, particularly how some of these reforms that were actually supposed to improve things might be making them worse.
Okay, so let's talk about those reforms for a second. You're saying these changes that were designed to cut costs and modernize healthcare are actually kind of backfiring. How so?
Well, take digitization, for example.
Okay.
It aims to streamline services, make things more efficient. But pharmacists are really worried that it's actually eroding that crucial face-to-face interaction that they have with patients. They argue that, those conversations where they can explain dosages, potential side effects, check for drug interactions. They say that's essential for safety. And they don't think it can be, replicated through a screen.
Yeah, that makes sense. It's one thing to order refills online, but when you're dealing with, complicated medications or, have specific concerns, I mean, that personal connection with your pharmacist is pretty invaluable.
Exactly, and it's not just about advice either. Think about the 4 eyes principle with prescriptions. It's a safeguard where 2 pharmacists actually double check each other's work to catch any potential errors, right, before they dispense the medication. And they're really concerned that understaffing and the increased pressure, partly driven by these reforms, it's making this principle harder to uphold, and that's increasing the risk of mistakes.
Oh, that's a little scary. I mean, are there any stats on how often errors occur under normal circumstances with this 4 eyes principle? Because if it's already a concern, imagine what happens when that safety net is stretched even thinner.
Yeah, that's a great question. Unfortunately, the sources you sent don't really dive into specific error rates. But pharmacists consistently bring it up as like a cornerstone of safe medication practices. So that's why they're so worried about anything that might compromise it.
Yeah, I see why they'd be raising red flags about it. It's like they're being squeezed from all sides here. Expected to do more with less, deal with frustrated patients, and now on top of that, they have to worry about potential risks to patient safety. It's no wonder they're feeling burnt out.
And we haven't even talked about the medicine shortages yet either. The Netherlands has been dealing with this issue for a while, and pharmacists have often had to find creative workarounds just to make sure the patients actually get the medications they need.
Wait, so they're being penalized for trying to solve a problem that they were basically told to fix? How does that even make any sense?
Right, that's where it gets really interesting. Yeah. So for a while there, they were allowed to import medicines from abroad under this system called the Shortages Decree, right? Trying to make up for these gaps. But then recently, the Council of State, which is the highest advisory body in the Netherlands, they ruled that this decree was actually unlawful. So it basically created this legal gray area that pharmacists were, they were operating within. Yeah. And now that rug has been pulled out from under them.
So what happens now? Are pharmacists just supposed to shrug their shoulders and tell patients, sorry, you're out of luck? That can't be right.
Well, it's created a huge dilemma for everyone, doctors, patients, and pharmacists. They're all understandably upset, right? Yeah. They're arguing that this decree was unnecessary, like a Band-Aid solution to a much larger problem. And the government, kind of caught between a rock and a hard place, they've temporarily instructed the healthcare inspectorate to look the other way while they try to figure out a more permanent solution.
So they're acknowledging that there is a problem, but they don't have a clear plan to fix it just yet. And in the meantime, the pharmacists are stuck dealing with everyone's frustrations.
Exactly. I mean, they're the ones having to explain these shortages to patients, deal with the uncertainty of sourcing medications, all while trying to keep up with, their regular workload. It's a pressure cooker, and it's no surprise that it's finally boiled over into this strike.
It's like they're caught in the middle of a system that just isn't working, and then on top of that, they choose to strike during the holidays, which adds another layer of complexity to this whole thing. What was the reasoning behind that timing?
Well, while it might seem like a strategic move to maximize, disruption, the pharmacists are claiming it was truly a last resort. They say they've been trying to negotiate better working conditions, fair pay for a long time, and they feel like their concerns have been ignored.
So it's not just about the money, it's also about feeling heard and feeling respected. I mean, they're basically saying, enough is enough, we can't keep doing this.
Exactly, and by striking during the holidays, they're really drawing attention to how essential their role is.
Yeah.
In keeping people healthy, even when the rest of the country is celebrating. They're reminding everyone that healthcare doesn't take a break, and neither do the people who provide it.
Okay, so we've got a perfect storm brewing here. We've got overworked pharmacists, frustrated patients, a government that is struggling to fix this broken system, and a strike that's bringing all of this to a head. So what are the demands? What are the pharmacists actually asking for during this strike?
Well, they're asking for a 6% raise, and they want it backdated to July. They argue that this would begin to address the issue of unfair compensation for their expertise and their workload. And they're also demanding, improvements to working conditions to try to address the overwork and the stress that's contributing to burnout.
And what about the employers? What are they offering?
Well, they're offering a 2% raise from July and then a further 5% increase next year. But they argue that their hands are tied by limitations that are imposed by insurance companies and government policies on healthcare spending.
So a pretty big gap there. It sounds like both sides are pretty dug in and no easy compromise in sight. So what happens next? I mean, where do we go from here?
Well, that's where things get really interesting, because the employers are actually taking legal action. They're trying to block the strike. They're citing concerns about patient safety, especially during the holiday season. And the government is trying to walk this tightrope,
right,
trying to mitigate the crisis, but at the same time appease both sides.
Sounds like a powder keg ready to explode. I mean, what are some of the potential consequences if this standoff continues?
Well, the most immediate concern, of course, is patient safety. If this strike goes on, we could see more disruptions to medication access, longer wait times, and potentially even an increase in medical errors as pharmacists are just stretched thinner and thinner.
And what about the long-term consequences? I mean, could this strike have ripple effects throughout the entire Dutch healthcare system?
That's a really good question, and one that I think we should definitely explore in the next part of our deep dive. You mentioned long-term consequences, and I think what's really interesting here is that this strike could actually be like a catalyst for wider change, not just for pharmacists, but for the entire healthcare workforce in the Netherlands.
So this isn't just about a few, disgruntled pharmacists. You're saying this could be the start of something much bigger.
Absolutely, yeah. I mean, we're already seeing signs of solidarity from other healthcare professionals like nurses, doctors, even administrative staff. They're watching this very closely. And if the pharmacists are successful in securing their demands, it could embolden others to start demanding better working conditions and fair pay as well.
It's like a domino effect. One group takes a stand and others follow suit. But wouldn't that just lead to even more disruptions in the healthcare system?
Well, there's definitely that risk, but it also presents an opportunity, right, for the Dutch government to finally address some of these underlying issues that are plaguing their healthcare system. This strike could be the wake-up call that they need to rethink their priorities and really invest in their healthcare workforce.
Okay, so let's talk about those ripple effects a little bit more. You mentioned patient safety as an immediate concern. What are some of the specific ways that this strike could impact patients if it drags on?
Well, I think one of the most concerning aspects is the potential for increased medical errors.
Yeah.
As pharmacies become more and more understaffed, that four eyes principle we were talking about earlier becomes harder and harder to maintain. And that could lead to mistakes in dispensing medications, potentially with pretty serious consequences for patients.
And we're not just talking about, minor inconveniences here. We're talking about people potentially getting the wrong dosage, the wrong medication, or even missing crucial doses altogether because they can't access their prescriptions. I mean, that's a recipe for disaster.
Absolutely. And those potential errors they can have, like the cascading effects, right? Patients could end up in the emergency room, which just further strains an already overburdened system. We could see longer wait times, delayed treatments, and even a decline in the quality of care across the board.
And let's not forget the psychological impact on patients too. I mean, the uncertainty of not knowing if they're going to be able to get their medications, the stress of having to navigate a system that's not working. I mean, it takes a toll.
You're absolutely right. The sources you provided actually highlight this very point. There are stories of patients with chronic conditions, like diabetes or heart disease, people who rely on daily medications to manage their conditions. And for them, the thought of not being able to access those medications, it's incredibly anxiety-inducing.
It's like this constant state of worry hanging over their heads. I mean, they're already dealing with health issues, and now they have to worry about whether they'll even be able to get the treatment that they need.
Yeah, exactly. And for those with mental health conditions, this added stress can actually exacerbate their symptoms, potentially leading to a decline in their overall well-being.
So the stakes are incredibly high here for everyone involved. But how is the public reacting to all of this? Are they siding with the pharmacists, or are they more concerned about the disruptions that the strike is causing?
It's definitely a mixed bag. Some people are very sympathetic to the pharmacist's plight. They understand that they're overworked, underpaid, that the system is failing them, and they see this strike as kind of a necessary evil to bring about some much needed change.
They see the bigger picture, the systemic issues at play.
Exactly, but then you have others who are just frustrated and inconvenienced by the strike. They need their medications, and they're worried about what's going to happen if they can't get them. Maybe they don't fully grasp the complexities of the situation, or maybe they're simply prioritizing their own immediate needs.
Which is understandable. I mean, when you're dealing with a health issue yourself, it's hard to see beyond your own immediate needs.
Of course, and it's important to acknowledge that both perspectives are valid, right? It's a complex situation with no easy answers.
Yeah.
But I think it's this very complexity that makes this whole deep dive so fascinating.
Right. It really does highlight the interconnectedness of everything within the healthcare system. You can't just isolate one issue without considering the ripple effects it's going to have on everything else.
Precisely. And it's a reminder that healthcare is ultimately about people. It's about the patients who need care, and it's about the dedicated professionals who provide that care. When one side suffers, the other inevitably suffers as well.
Okay, so we've talked about the potential consequences for patients, the public reaction, and the broader implications for the healthcare system. But what about the legal battle that's brewing between the employers and the pharmacists? Where does that stand, and what are the potential outcomes there?
Right. So the employers, as we mentioned, are taking legal action to try to block the strike. They're citing these concerns about patient safety. They argue that the strike is causing undue hardship, and that the pharmacist's demands are unreasonable.
And what are the pharmacists' arguments in response to that?
Well, they're arguing that they have a right to strike, and that they've taken steps to try to minimize disruptions to patient care. They also argue that the employer's concerns about patient safety are kind of disingenuous, given that they've consistently understaffed pharmacies and really created the conditions that led to this strike in the first place.
So it's a classic case of he said, she said, but ultimately it'll be up to the courts to decide whether the strike can continue or not. What are some of the possible scenarios that could play out here?
Well, if the courts rule in favor of the employers, the strike could be forced to end, which would be a major blow to the pharmacists and their cause. It could also set a precedent that would make it harder for healthcare workers to strike in the future.
And what if the courts side with the pharmacists?
Well, that would be a huge victory for them. and could give them a lot more leverage in their negotiations with the employers. It could also inspire other healthcare workers to take similar action.
Yeah.
Potentially leading to a wave of strikes.
Yeah.
Across the entire Dutch healthcare system.
Okay, so a lot hinges on this legal battle. But even if the strike is forced to end, it feels like the conversation that it sparked is far from over.
I completely agree. This strike has really brought to light some deep-seated issues within the Dutch healthcare system. And those issues aren't just going to disappear overnight, right? The government's going to have to find ways to address the concerns of these healthcare workers.
Yeah.
Improve working conditions and make sure that patients have access to the care they need.
And all of this is happening against the backdrop of a global healthcare crisis, right? We're seeing similar challenges playing out in countries all over the world. Overworked healthcare workers, strained healthcare systems, and this growing disconnect between, the needs of patients and the ability of these systems to meet those needs.
It's a complex web of interconnected issues, and there's no easy fix. But I think by examining this specific case in the Netherlands, we can gain some valuable insights into the challenges that healthcare systems are facing globally.
We've uncovered so much already, but I'm curious to explore potential solutions. Are there any models or initiatives in other countries that the Netherlands could learn from?
That's a great question, and one that I think we should definitely delve into in the final part of our deep dive.
We've talked about the problems, the potential fallout, but I'm really interested in solutions. Are there any countries or healthcare systems out there that seem to be getting this right? That the Netherlands could learn from?
Well, that's where things get a little bit more hopeful. It's not all doom and gloom. There are definitely examples out there, each with their own strengths and weaknesses, of course, but worth looking at.
Okay, give me some examples. What are some of the bright spots out there?
One country that often comes up in these conversations is Denmark. They have a universal healthcare system that consistently ranks really high in terms of quality and patient satisfaction.
What are they doing differently? What's their secret sauce?
Well, it's not really a secret. They invest heavily in their healthcare workforce. They offer competitive salaries, good working conditions, and strong support systems to prevent burnout. They also really prioritize primary care and preventative medicine, which helps to reduce the strain on hospitals and emergency services.
So they're taking a more holistic approach, focusing on keeping people healthy in the first place, rather than just treating them when they're sick.
Exactly, and it seems to be working. They have lower rates of chronic disease, higher life expectancy, and overall, people just report feeling more satisfied with their healthcare.
That's pretty impressive. But I imagine a system like that requires significant investment. Is it realistic for a country like the Netherlands to replicate that model?
It certainly wouldn't happen overnight.
Yeah.
But it's not impossible, I don't think. It would require a shift in priorities, a willingness to invest in the long-term health of the population, and a real commitment to supporting the people who deliver that care.
It sounds like almost a cultural shift, not just a policy change.
That's a good point. It's not just about throwing money at the problem. It's about creating a culture of respect and appreciation for healthcare workers, recognizing how essential their role is in society.
So Denmark is one example. Are there any others?
Another interesting model is Canada's single payer system, where the government is the sole payer for healthcare services, and this eliminates a lot of the administrative complexities and cost shifting that we see in multi-payer systems, like in the United States, for example.
But doesn't that come with its own set of challenges, like longer wait times and limited access to specialists?
Yeah, those are definitely valid concerns, and it's true that wait times for certain procedures can be longer in Canada compared to some other countries. But I think it's important to remember that every system has its trade-offs. The Canadian system really prioritizes equity and access, ensuring that everyone, regardless of their income or social status, can receive essential health care.
So it's about finding a balance, right? A system that's efficient and cost effective, but also equitable and accessible to everyone.
Exactly. And it's not just about looking at other countries either. There are also some innovative initiatives happening within the Netherlands itself that could point the way forward.
Oh, like what?
Well, for example, some hospitals and healthcare organizations are experimenting with new models of care that focus on teamwork, collaboration, and shared decision-making between healthcare professionals.
So breaking down those traditional silos between doctors, nurses, pharmacists, and other healthcare staff.
Exactly. By working more collaboratively, they can share expertise, reduce workload, and improve the overall quality of care.
It sounds promising, but I imagine it takes a lot of effort to change deeply ingrained habits and hierarchies within the healthcare system.
Absolutely, yeah. It requires strong leadership, a willingness to embrace change, and an ongoing investment in training and development. But the early results from these pilot programs are pretty encouraging. They're seeing improved patient outcomes, reduced burnout rates among staff, and a greater sense of job satisfaction.
So there's hope. There are solutions out there, but it seems like finding the right path forward requires a multi-pronged approach, learning from other countries, experimenting with new models, and most importantly, investing in the people who make the system work.
You hit the nail on the head. It's about recognizing that healthcare isn't just a system. It's a human endeavor. It's about people caring for people. And if we want to create a sustainable and effective healthcare system, we need to start by valuing and supporting the people who dedicate their lives to that care.
Yeah, it's a powerful message, and it brings us back to the striking pharmacists in the Netherlands. Their actions, whether they ultimately succeed or not, have ignited a crucial conversation about the future of healthcare, not just in the Netherlands, but globally.
And that's perhaps the most valuable takeaway from this whole deep dive.
Yeah.
We've explored the complexities of this issue, the potential consequences, and the glimmers of hope that exist. But ultimately, the question remains: what kind of healthcare system do we want to create for ourselves and for future generations?
It's a question we should all be asking ourselves. And on that note, we've reached the end of our deep dive. But the conversation doesn't end here. We encourage you to continue exploring these issues, engaging with your local communities, and advocating for a healthcare system that prioritizes both quality care and the well-being of those who provide it. Thank you for joining us on this journey. Until next time, stay curious.